Hi everyone, my name is Dr. Obanya. Today is World Diabetes Day. Today is the day set aside to create awareness, to promote prevention, and to help those living with diabetes. What is diabetes? Diabetes is a chronic condition whereby your body either does not produce insulin adequately or your body does not utilize the produced insulin, thereby increasing the level of glucose in your body. What are the types of diabetes? Type 1 diabetes, in this condition, your body immune system attacks cells in your body that produces insulin, thereby destroying it. This is most common in children, even though it can occur at any age. So type 2 diabetes here is most common in adults, even though it can occur in children or adolescents due to risk factor like obesity, sedentary life. In this condition, your body produce either your body produce insufficient insulin, your body does not utilize the produced insulin. Another type of diabetes is called gestational diabetes. This usually occur during pregnancy and it disappears after giving birth. Other specific type of diabetes include those that are caused by genetic defects, those that are caused by medication, like people that take steroid like dexamethasone, they can develop a special type of diabetes. So, what are the risk factors of diabetes? These factors are those factors that increases one's chance of having diabetes. They include age. Those that are above 35 to 40 years are at risk of having diabetes. Those that have a family history of diabetes. If your parents or your sibling have diabetes or have had diabetes, one is at risk of having diabetes. Those that eat unhealthy diet, like diet that is high in sugar, refined carbonated drink, they are at risk of developing diabetes. Those that live unhealthy lifestyle, like sedentary lifestyle, those that have heart diseases like hypertension, high abnormal cholesterol, those that have had a history of gestational diabetes when they were pregnant. This increases chance of having a pregnancy, having diabetes after giving birth. So even polycystic ovarian syndrome in women is one of the risk factors that can predispose one to have diabetes. So who gets tested for diabetes? Those that are above 35 to 40 years should be tested for diabetes. Those that are obese or overweight should be tested for diabetes. Those that live a sedentary lifestyle and those that have a heart condition like hypertension, high abnormal cholesterol, or stroke should be tested for diabetes. So, what are the complications of diabetes? There are so many complications. These complications arise from high level of resistance, high level of glucose in one's blood. So it affects so many systems. In the eye, it can cause a vision problem. In reproductive system, it can cause weak erection in men. It can reduce sexual sensation in women. So in your foot can develop ulcer, gangrene, which can lead to amputation. In your neck, they can reduce nerve sensation. So there are so many complications of diabetes. So how do we prevent this complication? We prevent it by early detection. And how do we detect the diabetes very early? By regular testing. If you know that you have the above the mentioned risk factors, you need to get tested as early as possible, because early detection prevents complication, or manage some of the complication, thereby preventing further complication. So is diabetes a death sentence? No, diabetes is not a death sentence. If it's detected earlier, it can be managed. Even though diabetes currently does not have a cure, but it's manageable. There are a lot of people who are with diabetes that have lived a healthy and long life. So if you're watching this video and you are diabetic, or you have someone that is diabetic, the person should not lose hope. The person should adhere with his or her medication, ensure regular blood glucose monitoring. If you have any concern, you go to hospital and see a doctor. And most people that have diabetes, because of the fact that they normally come down with some of them normally come down with foot ulcer. If not, if your blood sugars are not adequately controlled, or some of them that are not regular on their medication, they can come down with foot ulcer. So anytime you notice any blisters or injuries in your leg, please, on your foot, please see a doctor. Don't self-treat yourself. Don't manage yourself. Okay, so if you learn something from this video, don't forget to share and follow for more health tips. My name is Dr. Y. I teach preventive medicine. I make everything about your health simple and practical. Share this video for me so that other people can see and benefit. I wish you happy diabetes day, and don't forget to support those living with diabetes.